And we want to start today in our launch with some opening remarks from Dr. Sarah Viebeck, the Chief Science Officer at the Public Health Agency of Canada. So I would like to turn it over to Sarah to begin. Thank you, Sarah.
Thank you, Jeff. Bon après-midi, good afternoon, colleagues, and congratulations. It's really a pleasure to be with you this afternoon as you launch this new tool. I am joining you today from Ottawa, and Ottawa is the unceded, unsurrendered territory of the Algonquin and Anishinaabe peoples. And as a public servant, I am committed to our collective responsibility toward reconciliation and learning and unlearning a lot as I try to understand my role within that reconciliation picture. And so I join colleagues in Toronto and in Midland in acknowledging the traditional territory from which I'm joining you. I am really delighted to be here on behalf of the Public Health Agency of Canada. We helped to fund this new tool, and we are really proud to be supporting HealthyPlan.City and to have supported the entire HealthyDesign.City's project. And I offer my congratulations to you on the launch of the tool. In my role as Chief Science Officer at the Public Health Agency of Canada, part of my mandate is to ensure that the environments in which BAC funds and conducts and uses science is really rich. And part of that is through collaboration with extramural science communities like yourselves. I want to ensure that strong data and science informs the work that we do in public health so that our policies and programs and actions are based on the best available evidence and really support the connections of public health science across disciplines, across sectors, and across jurisdictions. In a lot of ways, I think that this tool is a really great representation of this mandate. And its launch, I think, can help support the goals of the Public Health Agency of Canada in protecting and promoting the health of people in Canada. In public health science, you all know this is your field or you are interested partners in public health. We draw on and foster the complex relationships between our built environments, like those in our cities and communities, and the health of people that live in them. And this includes factors like the availability of healthy food environments, environments enabling physical activity, clean air and water, and the influences that our environment has on chronic or acute illnesses, proximity to community supports, and the impacts of health emergencies, and so much more. So the ways in which we understand and subsequently design our cities can have significant impacts on public health. And recognizing this, there's a need for strong data that links demographic and city-based information with population and public health. As you know, people experiencing inequities are often at a higher risk of poor health outcomes, especially during public health emergencies. And we certainly saw this demonstrated during the COVID-19 pandemic. The pandemic interacted with existing inequities, and many populations experienced worse health outcomes from COVID-19 as a result. While our COVID-19 response ultimately did take measures to address inequities, one of the barriers initially experienced in COVID-19 was a lack of accessible data with respect to equity, including interoperable and disaggregated data about inequities and populations at risk, especially at the community level where action was often being taken. So as we shift to pandemic recovery, we know that new and emerging threats are coming into the fore, often simultaneously, and this includes the impact of climate-related disasters. And this will continue to have a disproportionate impact on people across Canada. Ensuring that we're prepared with the data needed in order to better understand the risks to different people and communities is an absolutely imperative part of public health work. HealthyPlan.City is an excellent tool, not only because it provides clear and accessible information regarding our built environments across Canada, but specifically on the environmental factors which may contribute to inequities. This type of data is extremely important with respect to better understanding of factors which may put specific populations and communities at risk, so that we can develop better approaches to protect and promote the health of all Canadians. This can occur through how we design cities and other environments, through to the policies and programs we put in place to support health during public health emergencies and in inter periods. In 2022, the Chief Public Health Officer, Dr. Tam, focused her report on climate change and public health. And just last month, she released her 2023 annual report called Creating the Conditions for Resilient Communities. The report reflects our experience in our pandemic response and proposes the notion that health promotion and equity should be considered as a critical component of the entire emergency management cycle, from prevention to preparedness to response and recovery. This includes ensuring factors like city design and healthy built environments are considered as part of emergency planning. Tools like HealthyPlan.City can be very useful in applying this vision effectively through creating the evidence required to link up urban planning and emergency management with equity. I want to mention that just yesterday, my office was really pleased to release a companion report around knowledge generation and research priority opportunities to support Dr. Tam's report, and I'll pop the information about that in chat. This was just launched yesterday, as I said, and will hopefully be the basis for funding opportunities by research funders across the country. And I urge you to take a look at it and see about the linkages to your research areas. In closing, I really want to commend the researchers for ensuring that this tool is not only easy to use and navigate, accessible to all, but also free. This aligns with our commitments to open science and transparency at the Public Health Agency and to strong, equity-committed and equity-focused science that can be effectively linked to public health and policy outcomes. I'm really pleased to have had the opportunity to join you today, and I look forward to listening in the rest of the webinar. Merci beaucoup et bon après-midi.
Thank you very much, Sarah, for your kind words and absolutely for joining us. I certainly appreciate the Public Health Agency of Canada and the support they provided to build this tool over several years of work. Let's get into the presentation, Danny. So today I expect that, I'm really speaking to the choir and that most of us here know that change is needed and that with change comes opportunity, as the Lancet here in their countdown reminds us again this year. And now in less than 2 days, COP28 begins, the first conference of the parties with a dedicated health day. Hooray. Next slide. But, recognizing health stake in this issue is not new. Approaching it from a health perspective and in terms of climate mitigation, climate adaptation measures and how they're designed and implemented is absolutely an opportunity for us to be following up on. Now, HealthyPlan.City is a tool that we think can help us get there. We're launching officially today this tool, and it's been a 7-year journey from the start of CANUE in the building of an environmental data platform to 3.5 years ago when Public Health Agency of Canada provided funds for us to create HealthyPlan.City so we can mobilize CANUE data for more potential benefits and impacts on public health. So we're bringing together health and the environment, something that's been part of CANUE's work for a number of years. But as we go through and learn about what other data are in here, there are ways we can see that there is relevance to questions around how we might mitigate climate change. Next one, there are also data in there that are clearly relevant to how we address climate as it's occurring around climate adaptation. And finally, this tool brings into its platform quite a bit of social demographic data that speaks quite clearly to equity. And in a lot of ways, I think I'd call this the quadruple bottom line. We're bringing together 4 very important issues into one tool. Also, in my view, it's not until we really address all of these that we're starting to move towards truly sustainable cities. And on a sustainable development goal basis, we could probably even go a little bit further and say we're actually at the quintuple bottom line, as many of the actions that are informed by HealthyPlan.City clearly involve number 9 here in the goals, infrastructure. And in the center of this, reducing inequities. Next slide. Now, as we were looking at the data that were coming together within CANUE and applications for the data, of which there are many, a hypothesis that kept coming into my mind was that we could use the data and look at inequities. And the hypothesis to test would be that reporting and tracking on environmental inequity as an indicator would spark progress towards sustainable Canadian cities. And it's from that notion that HealthyPlan.City got started. And we're looking at this as something that can accelerate solution-oriented work by democratizing data and targeting environmental equity along the way. Clearly an important issue that Dr. Vivek talked about. Now, if we take it from Canada's federal leaders, where a national strategy to promote progress on this issue is being identified as being needed, we can see where things stand in Canada. With Bill C-226, and the most recent update that I found is that its second reading in the Senate was just about a month ago in October. So this is very much in the forefront of thinking in terms of Canadian legislation. Senator Rosa Galvez described it very well back this past June, but also she very clearly noted the importance of improving community representation at the decision table, and processes to facilitate that engagement are very important. And that's one way in which I think having this tool, HealthyDesign.City or HealthyPlan.City, and having it freely available can bring many more people to the table, armed with, we hope, are quality data that's consistent across the country. Next slide, Danny. So the tool that's being released today does have multiple environmental indicators in it, along with sociodemographic indicators that Danny is going to demonstrate next. And I think that they will help us really think about that quadruple bottom line. Here's an example of what the data that we had pulled together in CANUE really told us about inequities in Canada, in a paper that was published a number of years ago, comparing Toronto, Vancouver, and Montreal across just 3 variables: the walkability of neighborhoods, the amount of greenness in a neighborhood, and the amount of air pollution in a neighborhood. And seeing how areas of lower socioeconomic status or highly deprived areas compare to less deprived areas, to observe that 50% there was lower prevalence by 50% of walkable areas in the lower, more highly deprived areas. And they're between 38 and 23% more likely to experience high air pollution in the Toronto, Vancouver examples there, and between 23 and 44% more likely to experience low greenness. So while inequities and environmental justice, environmental racism takes on many different colors and shades and affects many people differently, they can clearly be observed in Canadian cities, and it's something that we can use as an opportunity to improve. Now, I would like to finish by just pointing out that I think that HealthyPlan.City is something that can help advance thinking, sparking this quadruple bottom line thinking among stakeholders, and it's based upon common data, and it's a starting point that HealthyPlan brings us to. Now, it's not the solution, but I hope we all see this as a kickstart to get going on the work. But this is to be followed up from this kickstart of work on data to more detailed assessments of the opportunities that really it presents to us. And clearly, we're wanting this to be something that sparks action. So I would like to turn it over to Danny now, and he's going to demonstrate the tool and its features and some examples. Danny Doiron, I turn it over to you. Thank you.
Thanks, Jeff. So in my section, I'll outline the data we used in HealthyPlan and go over the tool's functionalities. So as an overview, HealthyPlan is a free web-based tool that allows users to easily map 25 different demographic and environmental indicators in over 125 Canadian municipalities. So as I'll show, the tool allows users to explore block-by-block distribution of health-relevant environmental factors such as air pollution, heat islands, and access to different community amenities. And the tool also allows overlaying demographic and environmental indicators to show a picture of environmental inequity in Canadian cities. Finally, HealthyPlan allows users to compare environmental inequity across similar sized cities and across neighborhoods within a given city. So I'll start by giving you a quick overview of the data we assembled for HealthyPlan. Firstly, the tool includes 12 different environmental indicators in 4 broad domains, which are listed on the right here. It's important to mention that all our data are nationally consistent, meaning that the methods that are used to measure, say, access to parks or air pollution concentrations are the same for the city of Vancouver as they are for the city of Halifax. We derive these indicators from a variety of sources, including high-resolution satellite imagery, large open source geospatial databases, and statistical and machine learning models. And finally, individual values for each indicator that is listed here are provided for each city block in the 129 municipalities included in the tool. Now, in order to examine how environmental and demographic indicators overlap in cities, we assemble 13 different vulnerable population indicators, which are listed on the bottom left here. Each of these indicators are derived from 2021 Canadian Census data and are assigned to each city block within the HealthyPlan cities. We also use 2 geographic boundary files from Statistics Canada. So first, the census subdivision, which is the municipal boundaries for each of our cities. And second, the dissemination blocks, which are used as the geographic units to which demographic and environmental data are assigned. And finally, to allow comparisons across neighborhoods in a given city, we obtain neighborhood boundary files from the open data portal of selected municipalities. Now, we know that environmental risk factors are not distributed equally across neighborhoods in Canadian cities, and we also know that certain demographic groups are particularly vulnerable to the health impacts of environmental risks, such as extreme heat and air pollution. So in HealthyPlan, users can visualize the spatial relationships between any of the environmental and demographic indicators I just presented using what we call equity priority maps. So for example, combining the heat and older adults indicators in this area of downtown Toronto provides a map of where a higher proportion of older adults experience higher summer temperatures. Now, to derive this equity priority map, we first divided each environmental and demographic groups into decile ranks or equal groups of 10, and based on their distribution within the city. And using the median values as a threshold shown here by the horizontal and vertical line in the matrix here, equity priority areas are defined as city blocks with vulnerable population deciles of above 5 and favorable built environment ranks below 6, or areas with relatively higher proportion of vulnerable populations and lower environmental scores. In the maps, such as the one that you see here, darker shades of red are used to show higher equity priority. So different combinations of indicators results in different equity priority maps. So for example, selecting low-income individuals rather than older adults updates the equity priority map according to where this population is concentrated in downtown Toronto and how it intersects with high land surface temperatures. Likewise, selecting different environmental indicators, in this case, access to parks, provides a new picture of environmental inequity for the same area. So the maps on the bottom here show where higher proportions of older adults and low-income individuals experience relatively low access to public parks in downtown Toronto. So HealthyPlan is the first tool in Canada to bring together this amount of nationally consistent data to visualize how environmental indicators affect vulnerable populations. The end goal of this tool is to support work that allows identifying where improvements to the local environment would promote environmental equity and benefit the health of vulnerable populations. I'll now go through a few slides to show you the tool's main functionalities. So this is the HealthyPlan interface. There are 3 drop-down menus on the left that allow you to select a city, and as well as built environment and vulnerable population indicators. The city drop-down menu displays the 129 cities included in the tool so far. I'll use Ottawa for this first example. Next, to see the spatial distribution of an environmental indicator, you can select it from the built environment drop-down list. So this screen shows the spatial distribution of tree canopy cover in Ottawa with the legend in the top left here. Users can also see the distribution of demographic groups by selecting one from the vulnerable populations drop-down list. So this map then shows the proportion of low-income visible minority individuals in each city block in Ottawa. And by combining this map with our tree canopy cover data layer, we get the equity priority map that I just outlined. So we see here the city blocks where low tree canopy cover intersects with relatively higher proportions of low income visible minorities. And as I mentioned earlier, the darker shades in this map show higher equity priority, or city blocks where tree canopy cover is lowest and the proportion of low income visible minorities is highest in the city. The window in the top right provides additional information for this combination of factors. So first, it shows the percentage and the number of low-income visible minorities in Ottawa that live in areas characterized by relatively low tree canopy cover. And secondly, in the bottom paragraph and in this histogram, it ranks Ottawa relative to other similar-sized cities in terms of the equitable distribution of tree canopy cover for low-income visible minorities. Rolling over these histogram bars here, a pop-up will appear with the city name and the percentage associated with the city. So we see that while 75% of low-income visible minorities in Ottawa live in areas with relatively lower tree canopy cover, this percentage is 60 in Hamilton and 78% in Mississauga. Toggling the distribution tab in this window displays a scatter plot showing tree canopy cover values on the y-axis and vulnerable population proportions on the x-axis for all city blocks in Ottawa. And by clicking on a city block, the point representing this location is highlighted in the graph, and users can then see that point's values for both the vulnerable population indicator and the environmental indicator. Clicking on a different location or a different block on the map updates the highlighted point in the scatter plot. So HealthyPlan also allows comparing neighborhoods within a city, as I mentioned earlier, but the neighborhood boundaries that we use for this function were obtained from freely available information on municipal open data portals. So this function is not available for all cities. It's only available for the cities for which we were able to acquire the boundary files. So when the function is available, a neighborhoods toggle will appear in the upper left. And clicking on it will add a neighborhood boundaries map or a mask to the map. So for the city of Vancouver, we have 22 neighborhoods here. When a built environment and a vulnerable population indicator are selected, in this case, average summer temperature and low-income individuals living alone, a histogram appears in the top right window. And when a user clicks on a neighborhood, the citywide proportion of vulnerable populations living in unfavorable environmental conditions within this neighborhood is reported. So in this case, we see that 15% of all low-income individuals living alone in areas characterized by high summer temperatures are in downtown Vancouver. The ranks of the selected neighborhood, the rank of the selected neighborhood relative to other neighborhoods in Vancouver is reported in the second paragraph and in the histogram bars here. And by clicking on a different neighborhood, this updates the window. And so we see that with this example, we see that close to 30% of all low-income individuals living alone in areas experiencing high summer temperatures in Vancouver are in the downtown and Strathcona neighborhoods. So finally, other Healthy Plan features include a community stories section where users can read about what communities are doing to promote healthy and equitable urban environments. The toolbar at the bottom left here allows users to join our mailing list and learn more about our project and methods. And finally, we also have a tutorial which outlines most of the functions that I just went through. Je dois aussi signaler que l'outil HealthyPlan ainsi que toutes les fonctions que je viens de présenter sont disponibles en français. So I'll pass it back to Jeff to introduce Dr. Anand, who will close our webinar with a case study from the city of Hamilton.
Thanks, Danny. That's very clear, and I noticed a number of questions were coming into the chat that we've been trying to answer, so keep questions coming in the chat. We'll have some more time at the end. It's now my pleasure to introduce Dr. Sonia Anand, who's a professor at McMaster University, who's going to talk about a program she's doing in Hamilton, and also how it's something that is an early user of Healthy Design and HealthyPlan.City. So Sonia, I think you're here. Please show your face, and we'll
face is shown, and I'm here, Jeff.
Hello, Sonia.
Hi, and thanks so much, Jeff and Danny. Nice to see you for the opportunity to come here. And Jeff and I have worked over the years on different cohort studies and different studies with different hypotheses and outcomes, but we really came together in our discussion about what can we do from a population health perspective moving upstream. And so as a clinician, I treat patients who have cardiovascular disease. As a researcher, I'm trying to prevent cardiovascular disease. And unfortunately, what we started to observe in Hamilton were newcomer children who lived in the east end of Hamilton, which is typically a low-income neighborhood, were presenting to McMaster Children's Hospital with adult onset chronic diseases, such as type 2 diabetes. And in particular, that was primarily due to developing overweight, sometimes childhood obesity, and really, not having as many opportunities for healthy, active living, as we call, the opportunities to consume healthy foods and to get outdoors and play. And so we applied and were funded by the Public Health Agency of Canada for this project called SCORE, Strengthening Community Roots, Anchoring Newcomers in Wellness and Sustainability. So right from the start, our goal was to connect newcomer children and their families to the outdoors, with really the hope that we could hardwire a love of the outdoors, green space, the beautiful Bruce Trail and other conservation areas in our neighborhoods. And no matter where newcomer families would move thereafter, this hardwiring hopefully would continue, their lifelong love of outdoor play. And so we've been working now for the past year and a half. If I could go to the next slide, great. Here in Hamilton, in the East End, I'll show you a map later, in a region called Riverdale, which is mostly made up of busy traffic streets that connect the QEW through the Red Hill Expressway to the top of Hamilton called the Mountain, and apartment buildings. And you can see here, these high-rise apartment buildings are home to the majority of newcomers in this region. And they essentially surround the local elementary school playing field. And you can see a picture of this playing field. And there are many barriers to getting kids from these families outdoors and playing. And we can anticipate that this problem is likely not unique to Riverdale, Hamilton, and not unique to Hamilton itself. And with our welcoming of newcomers, we really want to start to think about health at the outset rather than as an afterthought. So what we're trying to do in Riverdale is to understand the barriers and facilitators to healthy, active living. And if we go on to the next slide, we'll just show you all of, one back, the overview of our project. And you can see through the Public Health Agency of Canada, there are 3 phases. We're in the design phase right now. And during this design phase, we have done a number of different activities with this community, starting with evidence review, move to photo voice, where families go around with a camera and take pictures of their neighborhood, a household survey. The gallery walk refers to going into the school classrooms and asking children what are their favorite outdoor activities, their favorite winter activities, and barriers to doing those. We've worked with local partners such as Green Venture to work toward community gardens where our newcomer families have their own plot, and plant and garden and consume the products of the garden. And we're really trying to be different than the traditional ivory tower academic approach to problems, whereas we would stop at the evidence review and say, here's the logical solution, maybe do an RCT, maybe just implement the logical solution, only to find that it is not effective. So we've been working very hard to co-design our interventions and activities with the community. So we have a community voices, community advisory board. We do co-design workshops where we say, how can we get kids outside to play more often in the local field or to get them to parks? We've now started to pilot test these interventions. In summer, we have sport balls, soccer, tennis, free passes to the local conservation areas. In winter, a different set of activities, and we're evaluating. And all of this information will be put together and will inform the next phase of this project, which is called implementation. And I just wanted to point out that sometimes the problems that come to us cannot be solved by a research team or the community residents themselves. So we've also convened what we call our multi-sectoral policy roundtable that brings together public health, City of Hamilton, school principals, and other stakeholders where we present problems that we've encountered. And I like to use this example because I wouldn't have thought about it in my logical approach without having so much community involvement. That playing field I showed you that kids are sent out to play by their parents from the apartment buildings is littered with garbage. And that's a barrier to parents wanting to send their kids out. And okay, that's a problem. How do we solve it? Well, there were city rules that kind of led to only one garbage can being there and very infrequent emptying of the garbage can. So in our policy roundtable, we bring that up as an issue, and we figure out a way to double the garbage cans and change the pickup times. So that is what we do at the policy roundtable. And then finally, our stakeholders and partners are really important because we don't want to create a parallel program that goes away when we go away as an academic research group. We're trying to work together with existing programs at the Y, Green Venture, the City of Hamilton. If we go to the next slide, you can see on this map, way on your far right is Ward 5, and in red is the Riverdale region in which we work. And our plan for implementation is to expand the neighborhoods to a total of 14 in Hamilton. And the expansion is based on the proportion of newcomers in each one of those neighborhoods. And we determined that using the Census 2021 data, similar to what Danny was referring to. And so we'll go into these other neighborhoods that have at least 7.5% of newcomers to Canada in these regions. And we will use basically our learnings from the Ward 5 experience to develop what we call the SCORE Club for newcomer families. We'll increase spaces in the rec centers, and we'll try and increase connections to nature, either green space locally, or if there isn't green space locally, to other surrounding areas. And that's where Jeff and Danny's tool will be very helpful to us. And so we've been kind of discussing this as we've gone. We've tried to create our own systems map, but really Jeff's tool will be very, very helpful for us in planning our implementation. So if we go to the next slide, you can see how we might use this tool to help in our implementation. So I had shown you before the Riverdale area. It's now here in the circle. And based on the colors, as Danny described, we can see, there is likely limited green space there, and a higher proportion of newcomers. And Danny and Jeff, one suggestion: some of your cities, the term visible minority will not apply anymore, in particular in Toronto. So you might consider another term such as racialized people, because racialized people are the majority in certain cities. So if we go to the next slide, you can see that there are different ways that we've been engaging with our community. So we could use a tool like this to start the conversation, and we could say, this is your neighborhood, and hone in on this area and say, we can see there are some parks here. There is limited, green space. Can you give us your perceptions? And in fact, our household survey asks those very questions about the aesthetics of a neighborhood, and whether or not the individual feels garbage is cleaned up, there's enough tree canopy, etc. And part of our interventions have been to work together with our community to plant mini forests. For example, we did a planting about 4 weeks ago in Riverdale, where we brought out our families and planted over, I think, 500 trees in the mini forest. So those are types of activities that we could plan and be informed by this very, very helpful map. So if we go to the next slide, I think what Jeff has shown us here are the different features we can learn about. Just as Danny mentioned, we can help learn not only the proportion of newcomers, but also intersect that with income. So in the map I showed you of 14 neighborhoods, it was only based on newcomers, but the intersection with income and being a newcomer is really important. We're going to evaluate that impact in our next phase, but that could be something people use in planning for future studies. Next slide, please. So this is phase 2, as we call it, the implementation into 14 neighborhoods. And you can see already there will be some regions where we'll have to work with the community to try and determine which outdoor activities we can do, and what other activities we can engage in with families to enhance the natural or built environment. And finally, if we go to the next slide, I think that we're very focused on newcomers, and we often want to pull together information about the neighborhoods in which newcomers live. and we're thinking about health interventions. And if we had had this tool at the outset of the design, it would have been very helpful, but I'm very, very grateful that the tool is now available for us to plan for the implementation. So I'll stop there, Jeff, and if there are any questions or other comments you'd like to make, be happy to hear them.
That's great, Sonia. Yes, I know we did get some information in the chat, looking for wanting to connect with you directly on what you're learning in SCORE, and we'll revisit those questions coming up. But it's really great to hear about SCORE and how we can work together to enable what you're doing even better and better, and do similar things across the country. So much appreciated for you to share this context with us. Just, I want to wrap up with a few closing remarks. I really see that, with the tool that we have here, HealthyPlan.City, we're bringing environmental equity up to the front of the line in terms of ways we want to address today's urgent challenges. And we know that, there are urgent challenges, as I said at the beginning. And that means, there is really little time to waste in starting to make change. And we know we must start somewhere, because we really likely can't do everything all at once. And using an equity lens is one logical way to make a start. Now, we like to call this HDC. That's the cool people in our team. And it targets the health of vulnerable people at sort of the top of the list. But it does bring multiple data sets together and multiple data domains, as you've learned. And it creates the opportunity to develop solutions that tackle more than one issue at a time, and to get the data into the hands of activists and active people in communities, as we know is important to improve and deal with the issue of environmental equity. And even, the quadruple bottom line that I talked about, depends upon, what equity priorities you choose in terms of whether or not you can address 2, 3, or 4 variables at the same time. We really look forward to experimenting with it. So coming next, well, I've been seeing on the chat that everybody's trying it out and it's crashing already. So we have just last night, moved it to the link that we put here live for everybody to use. We've been working it in a developmental location for quite a while. So it's the first time it's gone live for everybody. I hope it doesn't cause too much trouble and is up and running as you experiment with it. So, please try it out, get creative. And very importantly, provide us feedback. Like Sonia talked about, her work is a multi-phase project, aiming towards improving public health and target populations. This is also a research project that we, again, want to acknowledge the Public Health Agency of Canada in supporting, and of course, the Canadian Institutes of Health Research for the original spark in getting CANUE going. If you work on it and provide us feedback, I'm sure we can learn together and improve this further. I see many suggestions coming even now in the chat. Now, under development into the future, and soon to be released, is another tool that we call HealthyPlace.City. And in that tool, that focuses on just the environmental variables, and individuals be able to select their location where they live and compare that location to other locations. So it's a tool that is meant to focus more on the environmental data sets we have for people to make choices about their daily lives or other choices. And it's a little more resolved since we're not mapping it with sociodemographic data. And we're working on a national report card that will be based on HDC's data domains. And that's something that I hope that will be coming out with soon. So stay tuned for our first report card in the near future. And as always, we're working to improve it in many different ways. We do see ways in which machine learning, artificial intelligence, and all the greatest tools could be brought to bear if they're trained and dealt with appropriately. So that's an area of research interests for us as well. So again, please go evaluate it after you've had some experience. Let us know what you think.
I'll just mention that Joey put a link to our user feedback survey in the chat. So as you've had a chance to try out the tool, please fill out that survey. It'll be helpful for us to improve it and gather feedback from users such as you.
Yeah, thank you. And now lastly, I really want to acknowledge the team that's been together working on CANUE and working on HealthyPlan.City for a number of years. You can see the pictures of the team members here. Clearly, Danny, as a co-director with myself in this endeavor, has played a huge role in making what you see happen to this time. So thank you, Danny, for all your hard work on that. I think we've got lots of interesting activities to do together in the future on this. I also want to acknowledge Eleanor Setton down there in the bottom left, who has retired, but also was very instrumental in making all of this happen. And finally, next slide. This project, was a project that did involve a number of advisors from across the country, from a number of different areas of expertise that helped us shape it from the beginning and through now to the end. You can see all of them here. Across the top are the co-investigators who were part of the original proposal for HealthyPlan.City. Acknowledge Michael Brower there, a longtime colleague who's been for a long time pushing for something like this. So hopefully, Mike, this is something that's now hitting the mark, and we'll learn and be able to move forward with it. And of course, our advisory committee that has representatives from across Canada, but also internationally. And with that, I want to thank everybody again for joining and your interest. Please spread the word, and we can work together to have this have real impact and improve it further going forward. So thank you very much. And I'll turn it back now to Joey.